conception, fertilization, placental development, that lecture. Fetal circulation, that will definitely be on there. Week 3 will be on there. That's all the physiological changes of pregnancy. I think I taped chapter 15, which was the maternal nutrition one chapter. Okay. So week 3 will be on there. Week 4, I will only do, what did we do today? 16 and 19. So 17 and 18 will not be on there. Okay? So we'll save that for the week after. The exam. And I just have to figure out how to get this up. Because I'm going to forever be like a week behind there. So are you clear on what's on there? All right. So 17 and 18 will not be on there. All right. The same will come into advance. All right. So I put on here this. So I will update this to reflect the chapters that will be covered. I put this on here. I didn't take this because I took this previously with another class. So OB questions are a little different than what you had obviously prior to the course. Okay. And just like when you're answering any NCLEX style question, there are key things in the scenario that you need to be pulling to help you answer the question. With OB though, if they're telling you mom's age, it's probably significant. So they might be saying that she's 27, they might be saying she's 42, they might be saying she's 15. So that kind of gauges as to if she's advanced maternal age, very old, very young, which will put her at that high risk category versus not. Okay? So pay attention to mom's age. Pay attention to gestational age. Is she full-term or preterm? Based on her weeks. That's important. Okay? So if they're telling you the number of weeks, and that could be 27.3, which means what? 27 weeks, 3 days. Correct. Or it could say 27 weeks and 3 days, but if it says 27.3 or 37.2 or whatever. Okay, so if they're telling you gestational age, that's probably important. So in your brain, is she full-term or preterm? Okay. No, I'm just saying. That's good, yay. Like, yeah, in your head, like as you're going through the questions. If they're telling you gestational age, you know, ask yourself, is she preterm or full-term? Okay? Is she young? Is she not old? But advanced maternal age versus not advanced maternal age. If they're telling you she's a first time, so multi-gravida versus a prime, that's probably important. Okay, so primogravida versus multi-gravida. So again, key things to pull out off the bat, without you even knowing anything else. So when we get to baby, we don't have a whole lot of baby questions on this exam because we haven't really talked about baby in the sense of, you know, gestational age and weight and stuff. We just kind of overview. But baby, if it's telling you baby is 28 weeks, 34 weeks, 38 weeks, like whatever gestational age is, I guarantee you that's important to help you answer that question. If it tells you baby's weight, that's important to help you answer that question. Okay? So those are all key things that you're pulling out, you know, in addition to the other information. All right? So you want to read, and this is across the board. This just isn't for just for OB. This is for how you take any of your exams. Read the question first. Don't read the answers and then try to put an answer into the question. If you have not learned already, NCLEX style questions have distractors. They are meant to see if you're actually reading the question. Okay? So yeah, there want to be some questions or there want to be some answers that technically could be applicable, but if you read the question appropriately, it's not the correct answer or the best answer. Okay? The other thing, what is the question really asking me? Most appropriate. What do you want to do first? What do you want to do next? Those are all like, questions that are usually in that STEM part, so it gives you the scenario, and then it will say, the nurse is doing or did blah, 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 what should the nurse do next? Okay? Or, you're the nurse taking care of these 4 patients, who do you see first? Those are all priority questions. Alright? So what do you want to use for priority questions? In your brain, what do you use for priorities? What's your go-to? ABCs. If any of them are not breathing, nothing else. Okay, airway, breathing, circulation, yes. The other one is Maslow's hierarchy of needs, right? That whole priority, safety, or any of those things, okay? So just in your head, if it's a priority question, it's asking, not to say, because students tend to say, well, because sometimes you'll read these questions, and be like, well, everybody should be saying first, right? But that's not, out of those 4 or however many, who's priority, who do you want to see? Delegation questions. Have you had delegation questions? Yeah. Okay, so delegation questions usually are, and NCLEX will phrase it like an unlicensed personnel or whatever. Here's my thing to students, because again, I recognize some of you work as EMTs. Some of you work as clinical care techs or nursing assistant, whatever your title is, because it varies from facility to facility. Either way, you don't have a license to practice, right? So when you're taking these exams, don't think, oh yeah, I had that patient last week that, and this is what I did. That's not what NCLEX style questions are asking you, not what you did in your job. Okay, so don't answer the questions like that, all right? It is an unlicensed, what it's really asking is, you're the RN, you have the license. The person that's working with you, if it really is an unlicensed personnel or nursing assistant or whatever, what can you actually delegate safely? You cannot delegate what? You can't delegate so medication gets tricky. If it's an LPN, correct. And even an LPN, because the scope varies from state to state, it will actually tell you if it's an LPN. It'll tell you if it's an LPN. But what can't you delegate as an RN? Assessments, number 1. You cannot delegate assessments. What else can't you delegate? Teaching. Any patient teaching, you can't go say, yeah, go show her how to do this, or tell her how to do it, okay? Those are all things that are under RN. So if it's asking those types of questions, that's how you kind of have to word it. All right? So I put this example, 29-year-old multi-gravid 37 weeks is being treated for severe preeclampsia, has max sulfate infusion. To maintain safety, the priority intervention is to, what are your key words? Multi-gravida, 29, so is she advanced maternal age? No, she's not a first-time mom, right? What else? 37 weeks, she's full-term or preterm? Full-term. Okay, what else? So preeclampsia, we have mag infusing, and what is the STEM asking? So what is the question really about? Safety of what? Of the patient. Right, but why safety? But what is the question? See, this is why I'm doing this. What is the question asking you? Safety about what? With the medication that's infused, what are we assessing first? You see what I mean? You've got to read the question and then say, what is the question asking you? Because that's what it's asking. So it's asking, and I don't put the answers up here purposely because I want your brain to say, pick out keywords and then ask yourself. So in your head, you should already have an answer before you look at it. You understand? Not the other way around. If that's your strategy, undo that. I don't know how on level 3, but undo it. Don't use that. That's not how NCLEX questions go. They have distractors built in to make you answer them a certain way. So you'll go through and kind of pick and say, oh, well, it's saying this and saying that, so it must be this answer. But if you really read them, it's probably not saying that if you're, looking at the answer. Does that make sense? Okay. So these are, so those were the ones that I highlighted, that I remember that you picked out. So here's some other questions. Nurses instructing a preeclamptic patient about monitoring the movements of her fetus to determine well-being. Which statement indicates she needs further instruction about when to call her doctor? When it says for an NCLEX love you. When it says further instruction, what are you looking for? The wrong statement. So that means all the other ones are right. You're picking out what's wrong. Got it? If it says that the other way around, it might not be further instruction, but that the patient understands the instructions, then you're looking for the correct answer. Right. Okay? After administering mag sulfate as prescribed for prima gravida with preeclampsia at 39 weeks, the nurse should assess the patient score. So this is an assessment question. So you need to know what things in order to answer this appropriately. You need to know what. What is the question asking? It's asking to assess what? Thank you. It's another math question. Okay? It's another math question. So you need to know what to assess for this person being on that. I'm scared. Do you understand that? Right, so even before you look at the answers, that's what I mean by being able to read the STEM and say, what is the question asking me? So it's really asking you, what are you assessing for a preeclamptic patient on that? So before you even look at the answers, in your brain, that should already be there. You understand? That's how you have to approach these questions. Select all that apply. I know those are your favorite. Select all that apply questions are true-false questions. The true-false no less. You're literally picking the correct statement. And you have to think of them that way. So as you go through, so that would actually be the opposite. So it gives you a scenario, it says select all that apply. You actually have to look at those answers first to figure out what the answer is, right? So select all that apply, you literally go through A, B, C, ask yourself, true or yes, no, true, false, however you want to do it. A, true, false. B, true, false. C, true, false, based on your script. You have to ask yourself that way. That's the only way to get to those questions. Okay?
For the examples, medication sheet that we made, is that going to be included?
I'm not asking this.
Yes.
You already took your course. Yeah, we get to high risk. The nurses planning care, this is one of the questions I was on. Nurses planning care for pregnant patients, which ones should be referred to a healthcare provider immediately? This is a priority question. So it's going to have four patients or so, read each one, and you got to kind of, then again, doing your priority, Maslow's hierarchy of needs, safety, if the patient can't breathe or what, then that's what you need to go see first. Circulation, cleaning, any of those things, okay? So again, and I was telling my other group of students, So if you have the answer as notifying the healthcare provider, right? It's not that they're always wrong, it's just not your first choice. Why? Thank you. You need, that's what I'm talking about. Y'all gotta do something first. And that's even in real life. If I call Dr. Smith and say, Miss Johnson in room 1 is having contractions, and that's the end of my story, I'm gonna get cursed out. Like, you better have something else to talk about. It's the same thing with NCLEX. If the nurse hasn't done anything yet, so they're just giving you the patient's history, but they haven't assessed, they haven't taken a vital, they haven't actually done anything, that's probably not the correct answer versus if the nurse actually did something, had an abnormal finding, and one of the answers, then in that scenario, that might actually, play that. But do you see what I mean? Like, you need to do something. Okay. So, this is what I tell students, you can study all day, you gotta find a way to push yourself. Whatever that is, it could be case studies, it could be the practice questions, it could be, whatever works for you is fine, but you just can't study, you need to find a way to apply what you have learned. That's why you take exams. All right? So you have more, my God, you have more than enough in your path. Okay? Whether it's for part of your grade or not, but all those things, all those different things that you have in there for each chapter, you can use. So if you need to go back to chapter 3 is heavy. I'm telling you now, it's heavy. That conception, fertilization, you gotta know those definitions, you gotta know those structures, you gotta know what they do, what they mean. Because as you're reading the question, you just want to get all jumbled. So, anything that you can do to practice that information is helpful. Your slides, I got emails, I have said this, and I think at Northern at this point. You use the slides as a guide. My slides are not enough for you to just study and pass. You will not just pass just studying the slides. It's not enough information. It's literally a guide. You need your book to go back and actually get the background in the detail and make sure you understand the concept. Okay, so anything that's not on, that I haven't covered, that's not on the slide, or anything, I'm straightforward with the information that is tested. You are tested on what was covered and what is on the slide. Anything that's not, it's not. So like 1 and 2, chapters 1 and 2, I pulled stuff from those chapters. Everything in those chapters are not on there. So just use what I went through. And there's stuff that I add on there sometimes. That your book doesn't cover, because I'm constantly telling you like what evidence-based practice is, what ACOS says, what A1 does. Because your book does do a good job, but there's other things that I'm doing. All right, videos. There's more than enough videos. There's tables, there's graphs, there's so much that you have. Just whatever works for you is fine. But my biggest thing is that you gotta find a way to test yourself or push yourself. Any questions?
How many questions, and there's going to be selects all that apply?
There will be selects on that, but get over, you gotta be friendly with them, I don't know what else to tell you. And I don't remember if they're the next group to get to meet Janice.
No,
You're not? Well, that's all that apply will be a walk in the park. Have you seen those national questions?
It makes me flush.
I went to a workshop and I was just like, woo! Yeah. It's, anyway, if you're not getting them, just embrace this what's all that stuff, because it's literally a walk in the park. And like I'm saying, it's a true false question at the end of the day. Number of questions, I usually do a minimum of 60. If you take a 50 question exam, it means you will not pass. You know why? Because how many chances do you have? For the 50 question, that's 2 points per question. It's too much content for me to boil it down to 50 questions, it's just too much. So I don't want to simply I do not like her asking me there.